My parasitology training is as a zoology, not as a medical problem. I love their complex morphologies, which are their complex physical structures. And so in the human, it usually manifests as an immature stage and therefore lacking certain features to help in identification.
A lot of times it comes back to you need a human on that scope, and that becomes a bottleneck. When the eyes get tired, the brain gets tired. And so is the quality of work at 8 in the morning as good as 2 in the afternoon if that technologist has been on that scope the whole time? Absolutely not. Microbiology has finally started to embrace imaging culture plates, imaging gram stains. I've always been looking for the newest technology to try to bring in the lab. And the problem is, a lot of times they fail. AI is exactly capable of what you push it to do. When we as a parasitologist look at a parasite like a protozoa, we see the essence of being Giardia. An AI model doesn't see it that way. It sees pixel densities and discrete textures that the human eye doesn't appreciate.
We used what's called supervised learning. You would take a slide and scan a certain area, and then you say, okay, these 100 things are Giardia. Then you send the slide back and you tell the software, this is what Giardia looks like, find more of these. And it comes back with maybe, say, 1,000 examples of things it calls Giardia. You confirm the ones are correct. You correct the ones that are wrong, and you do this over and over again, and the software eventually gets better at finding true parasites. The employees are spending more time looking at actual positive smears. The oven parasite exam is a horribly over-ordered, extremely insensitive assay. Docs love to just check the oven parasite box. Their positivity rate is at best 2 to 5%. So your technologists are spending a lot of time looking at negative slides. The AI that we work with, I think of it less as a parasite identification tool and more as a negative screening tool. I usually do the wet mount, then the AI, then the trichrome smear, which is what the AI is taken from.
Whenever I've presented in meetings or to colleagues at institutions that I think could benefit from AI, I use an analogy. In terms of lab medicine, this is no different than a automated liquid handler or a multi-channel pipette. It makes your job faster and more accurate. Our turnaround times may have been 5 to 7 days. We're at about 2 to 3 days. So we really cut a lot of that turnaround time down by just improving every step in the process to make it faster and more streamlined. Our technologists feel more confident. They're finding exactly what they're hoping for, and sometimes more.